COVID-19 public health emergency is now set to expire in May. The FDA is now working to simplify the process of getting fully vaccinated against the virus.
Yeah, so what does all this mean and what could life look like for Americans here soon? Well, our Megan Selensky is joining us live from the Alert Desk this morning with some advice from our Erie News Now contributor, Dr. Becky Dawson, to break it all down. Good morning, Megan.
Well, Mark, Brissa, good morning. I have Dr. Becky Dawson here with me. And Dr. Dawson, I wanted to ask you, what does this expiring of this public health emergency mean? It is set to expire in May. How does this impact us?
So I really don't think it's going to impact our day-to-day lives. You know, when we are in a public health emergency, it means that the WHO and other public health authorities are, you know, kind of all hands on deck towards one specific disease, one specific outbreak. And so I think it's just going to allow public health to go back to kind of what was, quote, normal pre-pandemic, but adding COVID-19, you know, to the list of normal things that will happen on a day-to-day basis.
And in your opinion, do you think we'll see some of these mask mandates come back anytime soon? I know we've been seeing a rise in some cases and it's kind of been fluctuating a little bit, but do you think that we will see some of these social distancing guidelines or anything like that come back anytime soon?
Not if the virus kind of stays the course. If we stay with this, you know, kind of highly contagious, but not causing a lot of severe disease form of the virus, I'm assuming that we will kind of keep on keeping on. I think what we can't predict is how the virus might mutate in the future. And if it would become more severe, so causing a lot more severe disease, I can imagine that being a moment that we would say, hey, masks are really necessary to keep people out of the hospital and, you know, from getting, you know, severely ill or dying. But at this point in time, no, I think we are going to kind of move into a phase where masks are used by people when they think that masks are necessary, not being mandated for everyone.
Well, the number one way to protect against COVID-19 is that vaccine, and we'll have more information on that and how to make it a little more easily accessible coming up at 6:30. Mark, Brissa, back to you.